Did you know stretching can be dangerous after your stem cell recovery? And I'm going to cover that inside this video. My name is Dr. Chris Garcia. I'm a leading expert in stem cell therapy recovery. I'm here to help you along your journey to make sure you're on that right path. Stretching is typically a good thing. We see it as a normal process to do when you're feeling stiff, before exercise, after exercise, or generally when you don't feel great. Maybe that's your posture, your low back, or your knees. As you struggle after stem cell therapy and you're wondering, what am I doing wrong? Or how do I avoid doing things wrong? One of the first things that we see that people do incorrectly, too much, too soon, too frequent, is stretching. Stretching is a normally great thing. However, after stem cell therapy, one of the things that you can do too much is move too much, stretch too much, exercise too much, basically do too much. And there are critical times where this is more dangerous than others. I'll walk you through step by step what that means for your recovery, but I do want you to understand stretching can be dangerous. The question is, when? All right, so now when we go through a normal stem cell recovery, anytime that you have had stem cell injections, which were directly inside a joint or intravenous or through your IV, you have to understand there's normal timelines that happened. Now, at the 0 mark, on the day 0 up until 2 weeks, if you've had IV stem cells, this is a critical time where you just have to relax and do nothing and just enjoy your daily activities. Now, at this time point, in those first 2 weeks, you should not be stretching. Do not stretch during this time. Just relax, do your things. Allow those stem cells to just absorb in those localized areas. So you shouldn't be focusing on intentionally trying to gain more motion or do those type of things. Okay, we've gone through 0 to 2 weeks. Now you're going to go from the 2-week mark to the 6-week mark. This is the proliferative phase. This is where you're going to start to move just a little bit more. You're starting your physical therapy journey. They're giving you some exercises to just generally increase some blood flow. This is where you're not stretching to end range. This is where you're generally starting to move and lubricate those joints again. This is where we would say this is where you're initiating stretching. Now, after this, when you hit that 6-week mark, this is when you can generally start to push things just a little bit more. You need to be under the guidance of a physical therapist. Just remember that. At week 6 is when you can confidently add stretching in without irritation, without a major concern. So if you're asking, is stretching a good thing after stem cell therapy? Absolutely. It's a matter of when. You definitely don't want that in the 0 to 2 week mark, and you want to slowly integrate, very slowly integrate from weeks 2 to 6, but you'll be confident to know that at week 6 is when you can do this. Now, the question we get after this is, well, what if I do yoga? Well, that's an extreme form of stretching typically, and it is a 30, 45, or 60-minute session. And so because of that, your body wouldn't even be able to handle it at the week 6. You would probably be introducing it between week 6 and week 12. Depends on the physical therapist that you're working with, but to be safe, you're probably going to introduce it at week 12. So if we say 0 to 2 weeks, no stretching. 2 to 6 weeks, you slowly introduce it, and at 6 weeks, you're confident that you can start it up until week 12. And if you love yoga and that's the thing that you get joy from, and that's your fitness, I wouldn't start that until month 3 or week 12. That gives you a better idea to understand that not one thing is going to flare you up. There's many things that are going to set you back, and stretching can be one of those. So if you're wondering when is it okay to stretch confidently at week 12, you can slowly introduce at week 6. Be sure that you're working with a physical therapist who knows exactly what they're doing and can give you these timelines. You don't want to get into a stretching routine thinking you're doing the best for yourself when you're actually setting yourself backwards. So if you have any questions about how to stretch, when to stretch, what's the best stretch, all of these questions, we'd be happy to help. Feel free to give us a call or send us an email, and we'd be able to help you to point you in the right direction. We know this is a tough progression. It's a tough thing to go through. Once you've gone through this stem cell therapy, you want to feel like your old self again, and stretching can set you back. And these are the little things that you can do to set yourself up for success. So there you go. Enjoy your real nice, easy, gentle stretching, and let us know if you have any questions along the way. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.